He authorized a new updated COVID-19 booster shot last week.
It is designed to provide protection against the original strain of COVID-19, along with the newest Omicron variants of the virus. Joining us to talk about the shot is Dr. Alex Garza, Chief Community Health Officer for SSM Health and the former head of the St. Louis Metropolitan Pandemic Task Force. Great to have you in studio.
Great, thank you. It's good to be here.
Well, first, tell us what makes this updated version of the booster different from the previous one.
Yeah, so the previous one, of course, was with the variant that we were dealing with before. So really the original virus that started the whole pandemic. So this is the first time we've had a vaccine that's been specific to the variant that's circulating now, that BA4 and 5, which makes up the majority of cases that are circulating.
And so, Dr. Garza, there are two versions, one from Pfizer and the other from Moderna. Are there any differences between the two?
Not a ton of differences. They're both mRNA vaccines. Really the only difference is the age limits on who can receive those vaccines. So with Pfizer, it's 12 and up, and with Moderna, it's 18 and up. And so they're going to be filing for clearance to get younger, but right now that's where it stands.
How important is it to get this booster?
Yeah, well, it's important because it has that added protection against the variant that's circulating now. And so it's important to get boosted just routinely. This one has a little bit added protection because it's so specific for the variant that's circulating now. So that's what gives it its extra level of importance.
Now, we know we are still in a pandemic. I mean, it's not over, right?
It's not over.
Yeah,
no.
So what is the situation in St. Louis?
St. Louis is looking better. So we had sort of a little bit of a mini, I wouldn't even call it a wave, I'd call it more of a ripple here over the summer. The cases are still continuing to come down, hospitalizations are coming down. Like you said, it's still circulating. We still have people in the hospital, but it's at a very manageable level now. And so we aren't predicting that we're going to see these huge spikes that we've seen over the last 2 years because there's so much immunity and because of vaccines.
Question, we hear about the flu shot because we're approaching that time of year. We've heard that people should get their flu shot and the booster and that you can do that on the same
Correct.
visit.
Yeah, no, absolutely. And from the White House the other day, you probably saw that they're most likely going to be recommending an annual COVID vaccination. So you still got to kind of wait and see what variants are circulating, things like that, but that may be a recommendation going forward.
Wow, how much we've evolved over the past couple of years.
I know. And real quickly, Dr. Garza, can you talk a little bit about symptoms for COVID-19 as well as for the flu? Because sometimes it seems like they can be similar.
Very, very similar. So, you know, they're all respiratory viruses. So fevers, muscle aches, coughs, all of those things, runny nose. But that's why it's important to get tested as well. And to get vaccinated so that you don't end up in the hospital by having a poor response.
I'm going to take it seriously. All right, Dr. Alex Garza, thank you so much for being here. And of course, thank you for what you do for the community.
Yeah.
Well, to learn more about the updated COVID-19 booster, just go to our website, fox2now.com.